So we're nearing that part in the program where we are starting to wind down. So I would love to hear closing comments from each of you. And before I do, and closing comments are anything that either wasn't said or that you would like to emphasize. And I'm going to throw in a couple of questions from the audience, our last couple of questions. Don't feel the need to address these. I just wanted to make sure that they got out there in case you wanted to address them. How do the arts and creative placemaking play a role in changing food behavior relationships? Doria, you addressed that a little bit, but we're looking specifically at arts here and how that relates to food insecurity. And then a bit of a controversial question here. How do we build gardens in low-income neighborhoods without increasing property value and displacing the families they are built to serve? So I'll toss that in your lap for your closing comments there.
You don't build gardens in a vacuum. You know, you actually are engaged in the larger, your larger political sphere, and you realize that your activities do have outcomes such as rising income, property values. So for instance, in Richmond, Urban Tilth doesn't just talk about food. We're guilty of talking about displacement and talking about social justice and economic justice and how all these things are interconnected. And, actually, when you teach ecology, you teach kind of a systems approach to life and living, and that, no one thing in the system is isolated, but everything actually has an impact on each other. And so, yes, me creating a beautiful garden in a once blighted community will radically change the property values and bring other people and possibly displace other people. So then we need to think about things like rent control. And we need to think about things like, how do we make sure we have incomes for low-income people, a minimum wage. The minimum wage in Richmond was voted to be raised so that people can afford to stay. How do we make sure we have local hire? How do we make sure that when we're doing this work, we're emphasizing hiring and training the people from that community to lead? It's not a guarantee that people won't get pushed out. People are getting pushed out of Richmond now. But it's at least something that you can do so you're not a complete victim.
And I just want to follow up on that.
And remember that these are your closing comments as well.
Because this comes up in San Francisco all the time, where I've done more of the work on urban agriculture. And I think what I would say is exactly what Doria said. Gentrification, displacement's happening probably regardless of whether that garden gets built or not. There are broader forces at work, economic forces, where here especially, you have industries that pay enormous amounts of money for the work people are doing, especially in the tech industry, and that has ripple effects on the cost of housing. And that is not related to whether there are gardens being built in your neighborhood, and has a way larger impact. It's not to say you won't see higher property values, but I think it's a small drop in the bucket compared to the bigger things at work. Okay. My biggest point I want to leave you all with is here in the Bay Area and nationally, I think for years we've heard the message that we should vote with our forks. Make good, conscious consumer choices, and we've been talking about choices, and that's so true. But what we also need to continue doing is voting with our vote. And Hillary made this plug before, and I really hope that all of you ask all your elected officials at every level, local, state, and national, what they're doing to address the issues we talked about. So that could be at the school board level, it could be at the state level when it comes to a minimum wage, it could be at the federal level when we talk about SNAP policy or otherwise. They don't talk about it a lot. Most elected officials are not being asked about this frequently. And we have an election coming up in November, and it's a great time to ask, and I encourage everyone to do that.
I'm going to roll back and just close a little bit too, and then pass it on to Hillary. And so I kind of want to close with the thought that we haven't really. What should we be thinking about as we kind of face the future? And we have, the war on poverty happened. When was that? Where we had the beginning of the war on poverty. It's been going on for so long, and there's very little change. In fact, things are getting worse. I think that we need to have a deeper conversation about what are our priorities as a people, as Americans. Is food a right? We actually need to have that question answered. Is food a right? Is housing a right? I just came back from Cuba, and in Cuba, it's a right. It's illegal to be homeless, not because homeless people are illegal, because everybody has a house. And nobody pays rent. Everybody has food. What kind of choices can we make as a people to ensure that everyone, all of our people, have certain rights? And that's kind of radically rethinking how we've kind of approached our culture for many, many, many years. I don't know what the years are. Once we really start with those larger questions, then some of the policies we need will make more sense and be more possible. And I think that in our various communities, we need to be having those conversations. How do we hold land? Should some land be communal? Be held collectively and managed collectively? I think that without really looking at ourselves and saying, what is it that we believe in as Americans, we're never going to solve these problems.
So let me close by bringing us back to food insecurity and health. And I think it's very clear that food insecurity is tightly related to health. And what we have done by adequately funding our healthcare system, or somewhat adequately funding our healthcare system and not our food system, is that we have shifted the burden to the healthcare system. The people who develop diet-related chronic disease as a consequence of their food insecurity, we are paying for down the line in obesity and diabetes. That does not make sense. Prevention is always more cost-effective than treating the complications, and it does not make sense for the families who have to deal with the poor quality of life that goes along with not having had access to healthy food through their entire life. So if we were doing the economically rational thing, if we were doing the cost-efficient thing, we would be investing upstream in prevention, and that means preventing food insecurity and preventing lack of access to affordable food. So I think we've heard tonight many, many different reasons why we should be more proactive about addressing food insecurity, but the fact that we're paying for them on the tail end through our healthcare costs, I think needs to be another one that we seriously look at as a society and decide we'd rather be investing those dollars in helping people eat healthy today than waiting till they get diabetes 10 years from now.
Thank you all. Thanks to Dr. Hilary Seligman, professor at the University of California, San Francisco Medical School. Thanks to Doria Robinson, executive director of Urban Tilth. And thanks to Eli Zegas, food and agriculture policy director at SPUR. Please also join me in thanking the California Wellness Foundation for sponsoring this enlightening discussion about food, health, and vulnerable Americans. I'm Nikki Silvestri, and now this meeting of the Commonwealth Club of California, the place where you're in the know, is adjourned.